Hello, everyone. Good morning. Welcome to another AMA with Dr. Behnam. Happy Tuesday. So I'm just going to give a 1 minute introduction about some of the topics we talked about last week. I just actually got off the phone with a patient who asked, "Can I apply the topical medication on wet hair or dry hair?" That's a very commonly asked question, and you could apply it on both. It doesn't really make a difference. You could do it dry hair or wet hair. So I want to kind of start off with that. Hey everyone, welcome to our AMA. Hopefully these AMAs are helpful, and if you have any questions, please type them in. So I'm going to read them off as we speak. If my hair is already pretty thin around my face, how much hair loss is possible when starting the solution? I'm worried about losing any more hair on the sides of my head since there's already been a lot of loss. So our product, the Happier product, has minoxidil in it, and minoxidil could cause an initial hair loss. That is true even with the over-the-counter medication. It usually happens within the first 6 to 8 weeks. The hair loss is typically not a lot, but some patients may experience some. In my experience, people who are actually losing a little bit of hair initially end up with better results. Um, but again, it's usually not much. Now, let's say you're using the product and you're the third month and you're still losing like a lot of hair, then I would basically stop the product. Usually, we ask our patients to send in like a before and after photo, and in over majority of the time, there's actually more hair at the third month, despite the fact that they're still losing. So, so that's just interesting. Being a woman, how high are the chances that a solution causes hair growth in other areas of the body where a woman wouldn't want to grow hair? That's a really good question. So, if you're applying the product in the front of your hairline, you are probably going to naturally get some hair on some of the product on your face. Usually, it happens when people are sleeping, like at night, you get on your pillow and you rub your face on your pillow. So you could get some hair growth or peach fuzz hair growth on the face, and unfortunately, sometimes it's unavoidable. I mean, we typically tell our patients, do not women patients not to apply directly on the hairline. You could be about 3 to 4 inches above the hairline. I kind of like gonna rub it into the front of the hairline. Definitely do not spill it on your face. But everyone's different. We do have a lot of females basically that use the product and they're pretty satisfied with it. Just try to keep it away from the hairline area, and I think you should be fine. Happy standard formula causes my hair to stick together and to mat down and stick to my scalp. Is the hydrocortisone in the ingredient acting as a glue? Um, no, it is not the hydrocortisone that's acting as a glue. So, in order to reduce some of the irritation from the product, we actually have a special base that is aloe based, and it is the aloe that's actually causing a lot of this gluing or stickiness. Um, we used to have a different formula where we did not have the aloe, but that was it caused a lot more irritation. So unfortunately, we're trying to find like a balance, like a good medium, with respect to the aloe. So that's really what's causing the stickiness. It's not the hydrocortisone, it's the aloe. Regarding ketoconazole 2% shampoo, how effective is it? How often should I use it? How long should one leave it on the scalp? So ketoconazole is an antifungal shampoo that has been used in dermatology for many years. Um, there's also the 1% ketoconazole over the counter. In clinical settings, it's been shown to actually increase the caliber of the hair, which basically means making the hair thicker. And I think in one study it showed that it's as good as using the over-the-counter minoxidil, interestingly enough. We typically have patients use it every other day. Do not shampoo your hair every day. So 2 to 3 times a week. Usually patients will leave it on for about 3 to 5 minutes in the shower. Ketoconazole could cause some irritation of the scalp. And I don't think alone by itself it's a magic bullet. Although I do have some female patients that literally swear by it. But we typically like to use it in combination with a topical happy head product. So again, so my recommendation is use it every other day, leave it on for about 3 to 5 minutes. If you get too irritated, cut down the usage. And look, it could help, with the happy head product. So, it's somewhat effective, yes. Is there any sort of edema with topical minoxidil use? Yes, there is. Some people could get a little bit swelling underneath uh, the lower eyelid area. It's actually very rare, but we've definitely seen it. So, if it happens, please stop, but that's a little bit unusual. How effective is once a day application versus twice a day application? So typically, if you use it twice a day, you're just going to have better results. I mean, as simple as that. However, there are some patients that only use it once a day, and that's fair as well. It really depends how comfortable you are using the product. I mean, if some people are very busy, they can't apply twice a day, which is fine. But the more you use it, the better results you're going to get, as long as you are not having side effects. And consistency is the key. The more you're consistent with it, the better results you're going to get. Is the 8% minoxidil significantly better than the 5% minoxidil? So the 8% is a prescription formula, the 5% is non-prescription. And in our clinical practice, patients that are just using minoxidil, not with finasteride or anything else, people that only use minoxidil do get better results in general. So we do think is better. There are, believe it or not, some products out there that are 10% minoxidil or 15% minoxidil. I honestly do not think that above 8% is going to give you much better, significant improvement without causing much more irritation. So that's why we stopped at the 8%. And for the females, we have it at 6%. But again, if you don't want the 8%, we could always customize this product for you, and we could reduce the concentration down to 6% or remove the minoxidil completely out of the product. Sound like you answered my question already, but I'm week 7 and I'm still shedding. Is this normal? Typically, patients shed between the 6 to 8 weeks. Again, but if you're shedding by the third month, I would be a little bit more concerned. But also realize that sometimes the more hair you have, the more you're going to shed. If you really reach third month mark and you're shedding, please send us a photo and let's compare a photo. Again, in my experience, patients that are shedding even to the third month have more hair than they started out with. So this is why taking photos at the beginning and month 1 and month 2, month 3 is important, because you will track your progress. But remember, if you shed more, you're actually going to end up with better results. And the reason is because it's actually resetting your hair cycle, and those patients typically do better. So there's a long question. I'm going to read it. My urologist has noted from blood tests from Quest Diagnosis that finasteride causes my testosterone level to increase significantly in the ranges of 1100 to 1500, which is not desired. If taken orally or if it's absorbed through the scalp when applied topically along with retinoic acid. Retinoic acid makes it easier for topical finasteride to penetrate. Has this been observed in other cases? Typically not. It is a little unusual. So most patients typically, when they do finasteride, they get a reduction of testosterone. And most patients typically say that, no, sometimes if they don't have side effects, which happens only 2 to 4% of patients, they typically say that their libido reduces. However, there are some patients that come and say that, doc, I started to do finasteride and now I have a much higher libido, or my testosterone has really gone up a lot. Again, these are very rare cases. I mean, it could happen, but they're rare. That is definitely not the norm. But to answer your question, yes, it has been observed. And again, my idea is that if the finasteride is really altering basically some of your testosterone libido is significantly, you should stop the product. Now, the retinoic acid does allow the topical finasteride to penetrate deeper. And if we feel that's the case in your situation, we could definitely take the retinoic acid out, and we could also reduce the finasteride concentration in your product and see if those make any difference and changes. Again, the key with Happy is that this is a customizable solution for hair loss. This is not one size fit all. and we are happy to customize the product so that we meet your needs and demands. Any side effect from product usage. So Happy Head is a combination of three different products: minoxidil, retinoic acid, and finasteride. One of the reasons why we made Happy Head initially was because we were seeing oral finasteride cause a lot of sexual side effects in our patients. And there were some clinical studies out there showing that topical finasteride reduces risk of those sexual side effects. Um, it doesn't necessarily mean that topical finasteride cannot have any side effects at all. It just reduces those risks of sexual side effects because you're not ingesting the pill, you're actually just applying it topically. But you could still get some sexual side effects from topical finasteride as well. And these include decreased libido, erectile dysfunction, testicular pain, testicular numbness. Minoxidil in and by itself could cause some irritation, headaches, and heart palpitation. And retinoic acid could also cause some irritation as well. Again, this is a customizable product. So if we need to change something in the product just for you, we will definitely be more than happy to do it. Please just just call or email help@happyhead, and we will be more than happy to help you with that. Other questions that are usually asked by our patients is that how often do I have to use the product to see great results? Typically, patients have to use the product for about 4 to 6 months to really see, a good effective results. Some patients do like to use the product at a lower dose of finasteride, like finasteride 0.1%, and which is great, and we could always basically um, increase the concentration to our standard formula, which is 0.25%. A lot of patients are already on oral finasteride and they want to get a happy it for two reasons. One, they don't like to take the oral medication, at which point, it's okay basically to taper off the oral as you're starting that topical happy head. Number two, they're not seeing very good results with the oral finasteride, or they've already plateaued on it. So it is okay to actually add on topical happy head, which is topical finasteride. And from our clinical experience, patients that use oral and topical finasteride actually do sometimes get better results. We typically do not want our patients to start with both simultaneously. I mean, if you're already on one, you can certainly add on the other. But we typically like to have like a 1 or 2 months lag time before you start both. What is the lowest concentration of finasteride offered by Happy Head, and what is the most effective? So we typically have two concentrations: the finasteride 0.1% and finasteride 0.25%. If you look at the clinical studies of finasteride, even finasteride 1% has been used. The reason why we use the 0.25% as the standard formula is because most of the studies and pharmacokinetic studies done on top of finasteride showed that the 0.25% gave you similar equivalent reduction in DHT levels as the oral finasteride 1 milligram. That's why the 0.25% was chosen, and that's where we see it's most effective. However, again, you could start out with the 0.1% and see how that one does. And if you're doing well with that and there are no side effects, we could certainly increase you to the 0.25%. What products are you guys releasing soon? That's a great question. But currently, we have the topical finasteride mixed with retinoic acid. We also have our topical dutasteride combinations along with minoxidil. For females, we have our topical spironolactone formulas with minoxidil. What we're releasing soon is our beard formula, which is the minoxidil and finasteride formula for our beard. And the question people always ask that why can't you use the same formula on the scalp, on the face area? We do not recommend it. The reason is because the scalp formula has a little bit of hydrocortisone, which is fine, but we don't want our patients to use that hydrocortisone chronically on their face. So we're having a special formula for the beard area that has the hydrocortisone removed. We're also coming out with the eyebrow formula. We are very excited about that. We're also coming out with our shampoos and conditioners, and Eric, our VP of operation right here, has already ordered that. We are also coming out with a very good multivitamin that will be supplementing basically the topical formula, which has a high dose vitamin D, saw palmetto, high dose biotin and collagen and keratin in it. So we are very excited about that. That has also been ordered and is being shipped to our distributors. And we're also coming out with our dandruff line. So patients with a lot of flakiness on the scalp, we're coming out with our ketoconazole 2%, along with a topical steroid that patients could apply to our scalp. So we are working hard at Happy Head to come up with like a lot of great products and just and inventing new stuff. So and we'll be sending out emails and we'll talking about them more in our future AMAs. Thank you for that question. What are some of the general recommendations you give to your patients to promote hair growth? So we truly believe in the holistic approach, and we believe that just using topical Happy Head, you need to kind of complement with other stuff to get your best results. Kind of like throwing the kitchen sink at it. So topical Happy Head will work quite well because there's 3 ingredients all in one, but also other stuff that will help you is derma rolling. So, so when you apply the product, you actually get a derma roller on Amazon and basically roll your scalp. We like the 0.25 depth. We don't want anything too deeper than that. And we don't want you to press too hard, and we don't want you to bleed either. So our recommendation is apply the product on, and then just derma roll basically the product into the scalp. Be very gently, and you could do a derma roll every night. One of the most common questions that's asked about derma rolling is that some people like to do it very aggressively, so they get the 1.5 millimeter depth. To my opinion, I think that's very deep. I would again use the 0.25. Other things that will help you is adding a multivitamin to your diet, adding a separate vitamin D of 2,000 IUs to your diet. For females, we also recommend adding iron to your diet. I like the Whole Foods liquid iron, which is 18 milligram. Higher doses of iron basically will cause more constipation. Just also a healthy diet is very important. If you're gonna eat chicken, make sure it's organic chicken. Don't try to do a lot of MSGs. Please stay away from whey protein isolate, which is used for muscle building. Stay away from creatine and soy milk and energy drinks. Do not vape and cut down on alcohol usage. Alcohol socially is fun, but a lot of alcohol will also deplete some of those multivitamins that are necessary for your hair growth. Thank you for asking that question. Would oral dutasteride work better? So it depends what you're comparing it to. There are studies comparing oral finasteride to oral dutasteride, and studies have shown that dutasteride works on two enzymes, whereas finasteride only works on one enzyme. So in clinical studies, dutasteride is a better drug than finasteride. Please realize that oral finasteride is an FDA-approved drug for hair loss, whereas oral dutasteride is an FDA-approved drug, but not for hair. So we recommend off-label uses for hair loss. I do have a lot of patients with oral dutasteride, and they do just fine. Similarly, in our Happy Head formulas, we have topical finasteride along with topical dutasteride. Our finasteride was the first product we introduced and is our most popular product. But if patients don't see much improvement with the topical finasteride, they could certainly do topical dutasteride to see better results. What makes Happy Head different from Hims and Hers, Keeps and Roman? That's a great question. So when we started Happy Head, Hims, Keeps, and Roman, none of them had a topical finasteride alternative. So we were the first one in the market to come out with a topical finasteride formula that was mixed and fortified with minoxidil and retinoic acid. Ever since we have come with a formula, Hims, and I don't believe Keeps or Roman, Hims has come up with a topical finasteride formula. But the difference is that ours is a customizable solution, which means that you could come up to me and say, Dr. Ben, I don't like my finasteride 0.25%. I like to take it down to 0.1%, and I want to change my minoxidil concentration. We will do it for you. Whereas with other companies, I'm not going to mention specific names, they just produce 10,000 bottles and there's only one formula. So it's either this or none. So, and they will just ship you out that bottle. Again, with us, we could customize it. Our bottles are fresh, made fresh on a monthly basis. They're not sitting on a shelf for a while. We do not believe in one size fit all strategy. We truly believe that every individual is unique and they have unique needs and their hair is different and their hair loss is different and they have different family histories and past medical histories. So we take all those into consideration and we try to customize the product just for you. And that's what makes Happy Head different than all of our competitors. And after 2 years of forming Happy Head, we're proud to say that we're still the only company on the market that provides a customized solution, and we really try to truly listen to our patients. Thank you for asking that question. But again, I do like Hims and Keeps and Roman, and I think they've done great in the market, and they definitely do offer accessibility to the patients, but we just do it differently. How effective Dermarollers by themselves? They are actually effective. There are some studies out of Australia that there are patients that just do Dermaroll every day and is effective. There's this myth on the web saying that if you basically do the 1.5 depth, you're gonna see better results. And I do believe, I think it is possible, but I think the 1.5 really does hurt quite a bit, and we don't encourage that. We encourage our patients to do the 0.25 depth Dermaroller and be gentle. Is it okay if a Dermaroller that use cause some pain, or there should be no pain when used? Well, a little pain is okay. We typically recommend using a very light pressure, like the same pressure that you do when you apply your deodorant. But I don't want you to be under a lot of pain, and I don't want you definitely to bleed. When we do it in the office, it's different. I use we do PRP and we Dermaroll aggressively, but that's different. At home, you should not be bleeding. You should not cause a lot of pain. Be gentle, everyone. Be gentle. I think that's very important. Once you start the topical hair solution, is it true that you have to use it forever, or whatever hair you have grown from using the product will fall out? So, with any hair product or any hair shampoos, any hair pills, whatever you do, once you start, you have to use it forever. There's no permanent solution from hair products, any hair products, unless you do hair transplant. That's the only one basically that you get permanent results. So the answer is that once you start the topical Happy Head, you do have to use it forever. If you do stop the product, basically your hair is going to fall out. Now, what some people may do, they might use it for 6 to 8 weeks, and once they're happy with the results, they might cut down to once a day, or once every other day, twice a day, and that will keep the results for the most part. But if you stop completely, the results will go away. Will kind of go away completely. Does minoxidil produce hair growth in the frontal and temporal areas? Yes, this is this is a very well-known misconception actually. When Rogaine came out with the product, they did the original clinical studies on the crown area. So on the bottle, it says that you can only use in the crown. And the reason why that is because that's what they got the FDA approval on. It doesn't mean they can't work other areas, but just legally unlabeled, they can't talk about it. So people just think naturally that so people think naturally that by that if they use the product anywhere else besides the crown, it's just not going to work. But that's not true. You can really use the minoxidil product basically everywhere, and it is going to work. So at temples, frontal hairline, that's all fine. In fact, I typically recommend it all the time when patients have basically hair loss in the frontal hairline. We typically tell the patients to put the Rogaine there or a top of a Happy Head and then Dermaroll it in, and that will help quite a bit, especially in patients, female patients with traction hair loss, where they're putting the hair in a ponytail and it's pulling really tight and they're losing that frontal area. So Happy Head does work there. Now, if you're going to use the Happy Head, do not, and if you're female, do not apply the product directly on the frontal widow's peaks. Go about 2 inches above the hairline, put it there, and then push it forward, because you don't want to get the product on your face, and that's going to cause peach fuzz. Great question. Will it help the frontal balding areas where there's no hair? So you're talking about the widow's peak where there's no hair. I have some right here, so right there. So if I put the product right there, there's no way it's gonna grow. There are no hairs at all. Remember, the topical product is like a fertilizer for your hair. You have to have some hair there. You have to have some roots, some seeds there. If you don't have any, it's just not gonna grow. So if you have a widow's peak where there are no hair, it will not grow at all. If you're thinning in the frontal area and there's some hairs there, it's just when you're thinning, you're seeing some see-through through the scalp. Yes, it will help in that situation. Um, I get a call, 1 or 2 calls a week with patients who are unfortunately completely bald and they say, "Will happy it work for me?" And the answer is no. I wish it did, but it's not. The reason because you're completely bald, there's just no hairs there for it to help. Doctor, would you mind repeating the supplement recommendation again? Thank you. So we typically recommend just a general hair multivitamin, and in fact we are coming out with one. So soon we're going to be having that on our website. Also, we recommend a vitamin D because most of the hair vitamins do not have a high dose of vitamin D. The Happy Head multivitamin actually has a very high dose of vitamin D, so you do not have to supplement with additional vitamin Ds. But most of the products out there are very weak in vitamin D, so you want at least about 2,000 IU's a day. And also, if you're female, you want to supplement with a separate iron. So we recommend the Whole Foods iron, which is 18 milligram liquid, which is non-constipating. Will Happy Head work on colored hair, or can it touch up the roots while using the treatment? Yes, it works with colored hair. There's no problem at all. It should not take out the hair color. And you could definitely do touch-ups on the roots while using the treatment. That's no problem. We just don't like a lot of too much hair coloring, and the reason is because, if you do it too much, you're actually going to cause more hair loss. Also, there are a lot of hair coloring out there that are safer than others. That could be a completely different talk. We could talk about it. Also, it's okay to go darker, but if you want to go blonde or lighter, that's actually a problem because the way to bleach the hair, the way the process works is that you actually have to use peroxide to remove some of the pigment in your hair, and you have to do it multiple times, and it's that peroxide that will damage the hair. So a lot of guys, that have gray hair and they want to color it, which is fine, just don't do it every day. But a lot of females that want to go blonder, that could be a problem. Why do you use hydrocortisone in the formula? That's a great question. So, hydrocortisone is one of the weakest steroid basically out there, and the reason why it's used in the product is because the minoxidil itself is irritating. So we use a lot of hydrocortisone to reduce some of the irritation from the product. Now, typically, the formula that kind of exists in the dermatology world uses a much stronger cortisone. So there's some formulas out there that use much more potent cortisone. We don't. We use a very, very, very weak cortisone. But again, if you don't like it, we'll be more than happy to remove it for you because again, this is a customizable formula. And if you don't want that in your formula, we'll be more than happy to remove it for you. So if that's the case, please contact support at help@happyhead, or basically with our phone number, and we could list our phone number basically right here. And we already have our phone number right there actually in the chat box. And we'll be more than happy to remove the formula for you. Will anything happen if I use the product after 6 months expiration date? Technically, no, but legally we have to put that expiration date on the product. Doesn't matter if the consistency and color of my Happy Head sometimes clear, sometimes yellow. No, it doesn't matter. It a lot has to do with basically when we ship the product. It really depends on how cold. Basically, it's being where it's being shipping from, where we're shipping it to, how cold it is as the product is being shipped, which FedEx facility is going through, the humidity, the climate. So a lot of those basically actually affects the product, not in a bad way, but basically that would basically sometimes change the color and the consistency of the product. Do you recommend a hybrid approach of topical and oral application? So it really depends. Every patient is different, and when you when you submit your consultation, you could certainly ask the doctor. Typically, we have seen from clinical experience is that when you use topical and oral together, you will have better results. And that's just the truth. The reason, because when you take it orally, it has to go through your entire body before it reaches the top. And when you apply topically, basically a lot of the product just remains just at the top. One thing we don't recommend is to start the topical and oral simultaneously, but you could, like, if you're already on the oral and if you've been on it for a few months and you start topical, that's fine. If you're already on topical for a few months and you want to start the oral, we'll be more than happy to write the oral for you. We also have oral finasteride. If you want to start both together, we recommend that maybe start with the topical finasteride first, so your body gets used to it. And then, like, after 2 months, you could start adding the oral finasteride. One question that actually was asked at the last AMA was that, do we offer oral finasteride? Yes, we do offer oral finasteride. It is on our website, and you can certainly order that as well. Is there any issue switching over to Happy Head if I've been using the minoxidil foam? No, there's no issue at all. The minoxidil form of the counter is 5% minoxidil, whereas our topical minoxidil is the 8%, combined with retinoic acid along with finasteride. Is a much, much more potent and powerful product compared to the minoxidil over the counter. So we encourage you to switch over and see how it does. Can Happy Head change hair color? Will it help with gray hair? It does not change hair color. It will not help with the gray hair. If we come up with something that will help gray hair, then I think we're going to be the most successful hair company in the world. We're working on it, but we're not there yet. We'll have our VP of Operation, Eric, put that on the to-do list. But it does not help with gray hair, unfortunately. What could cause it to be clear versus yellow? Is it the aloe vera? No, it's actually the combination of the minoxidil and finasteride. It's a little of the aloe vera, but again, it's also a lot to do with the precipitation as it's being shipped out. So that's really, really how it happens. Will the formula leave any residue on the scalp? Yes, it could. It's mainly the minoxidil that could cause a little bit of a dryness on the scalp. Not in everyone, but it is possible. If you get a lot of dryness, my recommendation is that please use leave-in conditioner that you could apply on the scalp. And if it's also too dry, you could also reach out to us, and we could also recommend a serum that you could use basically to reduce some of that dryness or residue. But again, not everyone gets it. Does this work for postpartum hair loss? Yes, it could work, certainly, but as long as you should not use the product, obviously, if you're pregnant or if you're breastfeeding. So if you're not breastfeeding, then you certainly use it. Also, when you apply the product, please wash your hands so you are not, basically accidentally applying the product to your infant or toddler. Should I expect different results if I use this spironolactone instead of finasteride? Well, there are two different products which are intended for different audiences. We do not typically give topical finasteride to females below age 50. So if you're below age 50, we typically do the spironolactone. If you're above age 50, female above age 50, I do believe that the topical finasteride could work better than the topical spironolactone. So again, it really depends on your age, if you're male or female. The doctor has to evaluate you and basically give you the correct prescription. And that's something that you should have a dialogue with your doctor once they do the Happy Head formula. I got a question saying, is it difficult answering questions? I don't understand what that question is. But if you do have some questions, please feel free to basically put in a chat here, or you can certainly email us. We have customer support staff, and if you ask a question, we'll definitely get back to you right away. And if there's any question regarding any specific doctor, like a doctor's question, you could definitely have the help desk forward it to me or your own doctor, and we'll be more than happy to answer those questions. Again, is it okay to use hair fibers after using Happy Head? Yes, there's no problem at all. Just let the Happy Head dry, and then you can certainly use the hair fibers. Not a problem at all. I think that's all the questions. Again, well, thank you so much for everyone getting online and asking these questions. We're going to be trying to do these AMAs basically every Tuesday mornings at 10 a.m. If you have any other questions, please feel free to email us at help@happyhead. We're always here to answer any questions and to follow up with any concerns that you guys may have. Again, I'd like to thank our VP of Operations, Eric, and also Evelyn, our assistant, for putting this all together and answering all and helping basically do this AMA. Have a beautiful day, everyone, and we will see you guys next week for another AMA.